Good morning, all. Today we are going to discuss about the anxiety. What is the meaning of anxiety? Anxiety is very natural phenomena. It is a natural or emotional response to the stimuli. Natural, emotional, and physical response to the stimuli. Stimuli can be internal and external. It can be internal as well as external. Anxiety affects the all age group. It is not this affecting the particular age group, rather it affects the all age groups. Anxiety is very broad, or you can say it happens to everyone. Typically, when we becomes anxious, we feel worried, upset, uncomfortable, tense. Basically, anxiety is a kind of emotional response to the stimuli. We are giving the emotional response. We are giving the emotional response to the stimuli. Stimuli can be internal or external. It can be internal as well as external. Anxiety affects all age group. Basically, it happens to everyone. Anxiety happens to everyone. Now, let's talk about the uh, types of anxiety. According to Charles Spielberger's 1966, anxiety can be divided in two types. One is state anxiety and second one is trait anxiety. State anxiety and trait anxiety. State anxiety basically based on the situations. It is temporary. State anxiety is a temporary kind of state of the person, or it is thoroughly based on these situations and it is not long lasting. On the other hand, trait anxiety is a kind of permanent dispositions, or it is a natural tendency to get anxious. State anxiety is temporary, or trait anxiety is more or less permanent dispositions of the persons. So trait anxiety is your natural tendency to get anxious. We can say it is the part of the personality trait, more or less stable aspect of the behavior. So anxiety can be divided in two types by Charles Spielberger's state anxiety and trait anxiety. Now come to the causes of anxiety. What are the causes? What are the etiology of anxiety? There are many causes of anxiety. Some of the causes or some of the etiology is related to the personality trait of the individual. Personality trait like reactive, highly sensitive, self critical, easily aroused, inability to accept one's ability or one's inability to accept one's negative emotions without judgment. There are certain factors or which are related to the personality trait of the individuals, and some of the causes of anxiety is related to the significant life event of the person. Significant life event. What are the significant life event? Like severe illness. If a person has developed some kind of illness which is very chronic in nature or which is very severe, due to severe illness, persons feel anxious, loss, divorce, and separations from the family member. Similarly, death in the family. These are the significant life event of the individuals, of the persons, which cause anxiety in the individuals, which cause anxiety in the person. Some of the factors which are related to the childhood circumstances. Because of childhood situation, because of childhood circumstances, persons feel anxiety, feel anxious. What are those factors? Parents who communicate an overly cautious view of the world. Parents always cautious about their children. They emphasize overly on the small activities. Parents who overly criticize the children. छोटी छोटी बातों पे पेरेंट्स अपने बच्चों को क्रिटिसाइज करते हैं, ओवरली क्वेश्चंस होते हैं। उनसे क्या होता है, चिल्ड्रन में वो हैबिट डेवलप हो जाती है कि वो अपनी जो लर्निंग है वो कोशिश बात बात पर चिंता करने लग जाते हैं वो बच्चे, बड़े होने के बावजूद भी, बिकॉज ऑफ चाइल्डहुड। क्योंकि उनकी जो पेरेंटिंग जो हुई थी या उनके जो चाइल्डहुड सिचुएशन जो थी, उनकी वजह से उनका नेचर ही ऐसा बन गया जिससे कि वो एंजाइटी करने लग गए। इमोशनल इनसिक्योरिटी एंड डिपेंडेंस। पेरेंट्स बच्चों को कई बार डिपेंडेंट बना देते हैं, इमोशनल इनसिक्योर बना देते हैं। तो इमोशनल इनसिक्योरिटी और डिपेंडेंस की वजह से भी बच्चों में आगे जाके एंजाइटी होने के ज्यादा चांसेस होते हैं। एक्सप्रेशंस ऑफ सेल्फ असर्टिवनेस। Some children are very suppressive in nature. They cannot interact with others. They don't want to interact with others. Because of suppressions, because of suppression of assertiveness, they may face anxiety in future because of their childhood, because of their childhood practice. Likewise, there are certain factors which maintain the anxiety, or we can say the maintaining cause of anxiety. Maintaining cause of anxiety, like anxious self-talk. Anxious self-talk. Always talking to oneself in an anxious manner. False belief. Due to false belief, anxiety is maintaining, or anxiety is maintained by the individual because of the false belief. मसल टेंशंस, मसल टेंशंस की वजह से भी आप देखोगे उन व्यक्तियों में एंजाइटी जो है बनी रहती है. हाई स्ट्रेस लाइफस्टाइल, अवॉइडेंस ऑफ फोबिक सिचुएशंस, दीज आर द मेंटेनिंग कॉज. क्योंकि एंजाइटी मेंटेन रहती है, वो एंजाइटी बनी रहती है उन लोगों में, और एंजाइटी उनकी खत्म ही नहीं होती, क्योंकि ये लगातार जो फैक्टर्स हैं वो एंजाइटी को बनाए रखते हैं. बेस्ड ऑन these maintaining cause, we suggest some of the treatment plan. Like if person has muscle tensions, we can reduce the anxiety of the persons with the help of Jacobson progressive muscular relaxation techniques, or muscular relaxation techniques, or relaxation techniques. We can help because we know the cause of that particular anxiety. He is having muscle tension. Similarly, if the cause of anxiety is anxious self-talk, we can replace that anxious self-talk by positive self-talk. We suggest that you start talking yourself in a positive manner. Try to talk positive. कोशिश करो कि आप जब भी अपने आप से बात करो तो अपने बारे में अच्छा ही बोलो, पॉजिटिव बोलो. आई एम गुड, आई एम फीलिंग गुड, आई एम वेरी हैप्पी, लाइक दिस. ओके, सो मेंटेनिंग कोज की को ध्यान में रखते हुए हम उनको, या कोजेस को ध्यान में रखते हुए हम ट्रीटमेंट सजेस्ट करते हैं. वैसे ही if the cause of anxiety is high stress lifestyle, we find that person is having the highly stressful lifestyle, we can suggest the treatment plan for anxiety. You go for holiday for sometimes. You go for holidays with family members for some time, because you can feel relaxed there, because you are having stressful lifestyle environment. And to change this stressful life event or stressful lifestyle, we suggest that you go outside so that that change can reduce the anxiety, so that that change reduce the anxiety level in the individuals. Okay, because of stressful lifestyle, we can suggest you go outside for the tour with your family for some times, so that the stressful lifestyle environment can be changed. Okay, some of the factors related to the lack of assertiveness, self skills, we suggest that we suggest the treatment plan for that cause, to make him or her skillful, make him or her assertive, how to talk with others, how to interact with your friends, how to behave in a classroom, how to behave in a college, how to behave in a playground. We make them understand the assertive skills. Okay. Similarly, mistaken belief or false belief. Because of false belief, the person develops anxiety. This is the maintaining cause of anxiety. We try to change the false belief of the persons by cognitive restructuring. We change the cognitions of the individuals. We change the thought process of the individuals by knowing that this is the thoughts and we are replacing that particular thoughts with the another one. This is called cognitive restructuring. We restructure the thoughts. We restructure the thinking, emotions, cognitions, perceptions of the individuals. You know, cognition is a broad term. Cognition includes thinking, perceptions, learning, motivations, everything includes, which are the mental process. So we try to restructure the cognition of the individuals and we try to change the false belief, false perception of the individuals, which creates the anxiety in the individuals, which creates problems in the individuals. Okay, so based on the causes of anxiety, we suggest the treatment of anxiety. Suppose a person has the cause of anxiety related to the parenting or related to the learning experience. We can apply the behavior modifications techniques. We are applying the behavioral modifications. We change the behaviors. You know, there are three principles of behavior modifications. How we can change the behavior of the individuals. First, we can replace the behaviors if possible. We can retard the behaviors. Replace, retard, and we can modify the behaviors. We can modify. So there are many techniques. There are many techniques based on the factors of which cause anxiety in the individuals.